Hi friends, Namaste and good evening from Richardsons Face Hospitals, Bengaluru. So I'm going to be talking to you all today about facial feminization surgery. So why this topic? Because in the last few months we've been getting a lot of queries. We've also been performing lots of facial feminization surgeries over the last decade and plus decade. So I just wanted to bring out a few points as to who needs a facial feminization and what is this facial feminization surgery at all. It's not that only patients who are undergoing a sex change surgery needs facial feminization. That's not the right thing. Facial feminization refers to any surgery on the face that is going to make the face more feminine. That's what it is. Now, with that understanding, I'm going to tell you about the different things that we can do on the face in a nutshell. And then in another video, we can go into the details of each procedures. All right. Now, if you look at the face, the first thing that you can change or do to make the face more feminine is the hairline. So we start with the hairline. The next thing is you can do on the forehead. So this is what I call as forehead contouring. So the shape of the feminine forehead is slightly different from that of the masculine forehead, especially the supraorbital rims, so we can correct that. The third thing is the shape of the eyebrows and the projection of the rim of the eye. Again, this is the forehead. At the edge of the forehead is the eyebrow. Above the forehead is a foreline. It's a hairline. So hairline advancement or hairline alteration, the first procedure. Forehead contouring is the second thing. Eyebrow reshaping is the third. The bone under the eyebrow, the supraorbital rim, is a fourth. Now, once you finish with these four, then we move on to the middle third of the face. The most important procedure in the middle third of the face is the nose. So it's a rhinoplasty. Noses can be made to look more feminine. We have a lot of different procedures for that. That's a whole new talk. But if you have any queries, I can clarify them. Apart from the nose, we also can tackle the cheek. So we can do what is called as cheekbone contouring to make the cheekbones more feminine, less strong or less masculine. That's the next thing in the middle third of the face. Moving down, you could do procedures on the lips. So you could do lip thinning. You could do lip lifts to alter the change of the size, shape of the lips subtly. And then moving on, the next major aspect is the jawline. So in the jawline, there's a difference between the feminine and the masculine jawline. So when you are feminizing it, so you would want to make the angles less prominent, basically slim it down so that you get a nicer, more feminine shape. The chin width can be reduced. The projection, the height, the width, all can be altered. So we can do chin contouring to make the chin more aesthetically feminine. We can do work on the jawline to make it more feminine. We can do facial slimming. So there are multiple procedures that we can add while we're doing the lower third of the face. And then moving on to the last procedure is the Adam's apple. So we can trim this off also. And this is just, I would think, the border or the periphery of the face. So we can reduce this as well. There are also voice change surgeries that we do here. We make the voice feminine. We have another colleague who comes and performs that. But anyway, that also is part because it's in the face. So all these procedures can be done sometimes at the same one go. Because, for doing the upper procedures, we can do the bicoronal. We can come from top. For the nose, for the cheek contouring, I do from inside the mouth. The lower chin, jawline, everything from inside the mouth as well. So a total facial feminization can be done in one go. And in such cases, I tend to refer to it as a face makeover because we're doing multiple different things on the face in order to bring about the changes that we desire. Now, moving to the next aspect, are these surgeries safe? Now, this is a very, very common question that's been asked to us. Now, with regards to any major surgery, the most common complication is infection and immediate complication of bleeding or issues like this. So these are something that is obviously there, relevant for even these surgeries. So what we are advising patients is when we are doing multiple procedures that needs long periods of recovery, we recommend you to stay over with us for around 10 to 12 days especially if it's bony, especially if we're doing a lot of change in the shape of even the chin, nose, forehead, or whatever. So that's the kind of timeline. If it's only a soft tissue procedure, for example, you're only tightening the lower eyelid skin, this is not exactly a feminization. This can be added onto your feminization surgery in order to make you look more youthful, younger, facelift, similar procedure. It's not a feminization procedure, but can be added to the all procedures I told you in order to give the face a younger look. So now you have a lot of procedures that we're doing to get the face to be more feminine. Also, we can add common procedures to make the face look younger. So even that can be added depending on the patient's desire, depending on what we see on the scans, and depending on what I think we could do for the patient in one go. So and this is the full umbrella. So when we have a patient, who's not necessarily having a sex change procedure and then doing this, that also is a case. There could be that, but there are also people, common people, anybody who wants a face to look more feminine, who wants to look more feminist. So that kind of changes is what I'm talking about. On a similar line, we can also make a feminine face more masculine. I'll probably talk about that in detail on another video. But if you have any doubts on any of the procedures that I've told you right now about how a face can be made to look more feminine, more proportional, more aesthetically appealing without any obvious scars and with permanent or lifelong results, then you can contact us with your pictures, with your queries. We're more than happy to answer them for you. I hope to see you soon again for another video. I'm going to take up masculinization very soon, and I'll come up with the different steps and different procedures we can do with that as well. Thank you.